Thank you for your interest in the nephrology program at Harbor-UCLA. We hope this short video will give you a glimpse into the rich training environment we have here in the heart of the South Bay of beautiful Los Angeles. Harbor-UCLA is a Level 1 trauma center with 553 beds. Our campus also boasts the Lundquist Institute for Biomedical Innovation. The mission of our hospital is to provide outstanding clinical care to the patients of our community regardless of their ability to pay. This combination of a county hospital, a world-class research institute, and the dedicated faculty and staff in our program make this a unique and wonderful place to both work and to train.
I'd like to talk to you all about why this is such a great program and why I'm here. And let's begin with really the patient population. Patient population of our hospital and our community nearby is that of underserved patients, really patients that have never seen a physician before. So they come in with very unique, rare, and at times very problematic issues and diseases, especially pertaining to the field of nephrology, which requires an immediate and aggressive as well as complex approach.
Our program offers a meaningful and well-rounded education that really prepares the fellows to be fully capable of delivering outstanding dialysis care. We have 3 outpatient dialysis centers that currently cares for over 200 hemodialysis and over 80 peritoneal dialysis patients. These dialysis centers provide opportunities for our fellows to learn from and to care for medically complex patients throughout their fellowship.
In addition to our outstanding training for in-center hemodialysis and at-home peritoneal dialysis, Harbor-UCLA training program will teach you provide at-home hemodialysis, which allows patients to have in-center hemodialysis experience in the comfort of their home.
Our clinics also provide a unique experience with a wide variety of renal pathology. In our glomerulonephritis clinic and our hypertension clinic, fellows will manage and diagnose glomerulonephritis, secondary hypertension, electrolyte disorders, and provide nutritional management of advanced kidney disease, along with managing diabetes and hypertensive kidney disease. The program also provides ample opportunity to master many procedures in nephrology. Along with placing lines for dialysis, our fellows master both native and transplant biopsies, along with CRRT and plasma exchange.
That is our greatest strength, that we have faculty who have love for teaching and deep expertise in all aspects of nephrology. So when you graduate, you're going to be an outstanding fellow, outstanding consultant, that you're well placed to take up any responsibility in the field of nephrology.
Here at Harbor-UCLA, we're very fortunate because there's a wide variety of research that's being conducted in nephrology. So really, if you come to Harbor-UCLA, you're giving yourself the opportunity to be opened up and exposed to the wide breadth of research that's available in this field.
We are fortunate to have a kidney transplant program here at Harbor-UCLA that is not only unique, but is successful. Our transplant program was initiated more than 50 years ago, so that we have long-term allograft patients that are followed in the post-transplant clinic. Our curriculum consists of not only the acute transplant phase, where you will learn how to initiate and manage immunosuppression, but you will also learn to treat and diagnose acute and chronic rejection. This makes our program unique in that you will be able to follow patients for the 2 years that you are here and see how they progress through transplantation. We are also fortunate to have a living donor program.
A living donor kidney transplant program that allows the fellow to learn the evaluations and determinations of normal renal function. There is a separate living donor team that evaluates and follows the potential living donor. We also follow our living donor up to at least 2 years after post-donations to establish their well-being and stability of renal function.
I'm a proud Harbor-UCLA nephrology graduate, and I'm currently a transplant fellow at UCLA. I encourage you really sincerely to consider this program. It's the best thing that happened to me, and it's the best thing that could happen to you.
Overall, patient volume and diseases that we see in our academic center is what makes this program unique and attractive. With that said, very fortunate, privileged, and honored to be here and work with such astute physicians and top nephrologists. I look forward to meeting everybody in the future, and thank you so much.
Hi there. If you're still with us, and I guess you like what you saw, I'm Sharon Adler. I'm Chief of the Division of Nephrology and Hypertension at Harbor-UCLA Medical Center. And from all of us at Harbor-UCLA, thank you for having given us the opportunity to share with you the enthusiasm that all of us have for our program, our fellows, our nurses, and our faculty. What we provide for you at Harbor-UCLA is the opportunity to train across the breadth and depth of clinical nephrology. When you graduate from the Harbor-UCLA Nephrology Training Program, you're prepared to meet any clinical challenge. You will either have seen it and managed it, or you will have the confidence to use the lifelong learning tools you developed in fellowship to create diagnostic and therapeutic plans of your own for unique clinical problems that you encounter. Of course, you will also have developed strong and long-lasting relationships with your fellow class and with the faculty as focus groups for your ideas, even long after you graduate. To the class of 2021, I want to reach out to each of you on a personal level. During this pandemic, many of you have been called upon to live the dedication and professionalism that represents the best of our medical profession in ways that most of us could not have really imagined, short of practicing medicine in an all-out shooting war. Many of you have toiled tirelessly. You have placed yourselves at personal risk, and you have seen unspeakable loss. I salute your heroism, while at the same time offering you emotional solace and even a celebration in the fact that nephrology saves lives. From the management of diabetic kidney disease and hypertension to slow progression, to being able to replace organ function with renal transplantation and dialysis, to immunosuppression and the dawn of precision medicine for glomerular diseases, the opportunity to make lives better is our business. I invite you to become a nephrologist at Harbor-UCLA to gratify your own personal needs to give as a physician. We are here to help you accomplish that. We wish all of you the best in the upcoming fellowship batch.